My name is Leslie Caldwell. I'm the Vice President for Education Initiatives at the Children's Campaign. In the 2022 session, we were thrilled to build on years of our work to improve Colorado's school finance system, to pass 2 bills that will get us closer to our vision that students' educational opportunity is not dependent on their zip code. House Bill 1202 creates a process for establishing a new measure for identifying our students who are living in poverty. This will shift Colorado away from our reliance on the submission of free and reduced price lunch eligibility forms and allow our school finance formula to more accurately allocate funds to serve our students. Senate Bill 202 creates a state mill levy override match fund to level the playing field for some of our lowest wealth districts who otherwise always struggle to adequately meet the needs of students. Over the last 10 years, districts have increasingly relied on the passage of local mill levy overrides, and that has increased funding disparities between districts. And so this fund will meet local voter-approved measures with a state match on a sliding scale. Finally, we were thrilled to work with more than 20 partners, including health, K-12, youth-serving organizations, to pass House Bill 1376, Supportive Schools for K-12 Students. This is a bill that updates Colorado's policies, practices, and data frameworks to ensure that data about students' experiences at school is more transparent and accessible. It ends harmful discipline practices that have been shown to harm students. And ultimately, it will help ensure that every student in Colorado is learning in an environment that is positive, safe, and inclusive. Thank you very much for following the work of the Children's Campaign.
Hi there, my name is Melissa Mattis, and I'm the Senior Policy Analyst for Early Childhood at the Children's Campaign. I am thrilled to tell you all about our legislative session for early childhood. It was truly transformational, building on the work of decades of champions for early childhood, leaders and advocates in Colorado who've been working for decades to make this dream a reality. House Bill 1295 was passed in bipartisan fashion to make this vision a reality of thousands of Coloradans who participated in our input sessions over the last over 2 years to align and streamline our early childhood system with the user experience in mind, to make it easier for families to find and afford childcare, and to make it easier for providers to participate in the system. This policy also sets us on a path to universal preschool, which will start in the fall of 2023. And we're just really thrilled to see this transformative change happen in early childhood in Colorado. We all know, though, that any early childhood initiative is only as successful as the caregivers who are working with our children. So the other huge successful piece of legislation I must mention is House Bill 1010, the Early Childhood Educator Tax Credit, that puts money back in the pockets of our early childhood professionals. This is a proven strategy used in other states to support recruitment, retention, and professional growth. Like I said, this lives out our vision, a vision where we value caregiving, we support families in their earliest years, and childcare and preschool are accessible no matter where you live in the state or how much money you make. Please reach out to me and stay connected with the Children's Campaign as we move forward.
My name is Sarah Barnes, and I'm the Manager of Special Policy Initiatives at the Colorado Children's Campaign. And we were so excited this session to work with the TANF Coalition to pass House Bill 1259. This bill improves the way the TANF program, or Colorado Works, supports families in our state who are experiencing extreme poverty and facing the greatest barriers to economic prosperity. The bill will increase basic cash assistance, or BCA, so that families can be helped in meeting their most basic needs, things like food, clothing, and diapers. The bill will also ensure that BCA keeps up with inflation and the rising cost of living in our state. House Bill 1259 also improves the TANF program in the way it supports families in other ways. It decreases sanctions on families, it updates work requirements in the program, it eases drug felony restrictions on access to the program, and it also helps smooth the cliff effect in the program for families. Finally, the bill will improve outreach and communication to families, and it will ensure that families have a voice in places where decisions about the TANF program are being made. We know that when children live in stable, predictable environments with connections to responsive caregivers, it supports their healthy development and it improves their outcomes into adulthood. House Bill 1259 will help support families in Colorado to be able to meet their basic needs so that they can provide the care that they want to give to their children.
Hi, I'm Erin Miller, Vice President of Health Initiatives here at the Colorado Children's Campaign. And I'm so excited to talk to you today about our big health priority bill that passed this last legislative session. It was House Bill 22-1289, otherwise known as Cover All Coloradans. And this bill did a ton to improve the health insurance coverage and healthcare landscape in the state of Colorado. But I think about its policy changes in three main buckets: improved health insurance coverage, improved perinatal supports, and improved data. So improved health insurance coverage is really the centerpiece of this bill. This bill expands access to Medicaid and CHIP for undocumented kids, pregnant, and postpartum folks in our state. So this is a huge policy shift. And it means that starting in January of 2025, kids up to the age of 19, pregnant folks, and postpartum folks will be able to enroll in Medicaid and CHIP, folks who've been historically unnecessarily excluded from those public programs. And we know these programs help improve health outcomes, educational outcomes, and overall family well-being. So this is a tremendous step forward for the state of Colorado. Second, the bill eliminates CHIP premiums for everyone in our state. We were one of the few states charging those premiums to families who make just a little bit too much to qualify for Medicaid, which can be a real financial and administrative burden for families. And this bill eliminates those premiums. Third, this bill creates a special enrollment period for pregnancy. Right now, the birth of a child is a qualifying life event that allows folks to sign up for coverage, but pregnancy has not allowed folks to sign up for coverage. And starting in 2024, uninsured folks who find out that they're pregnant will be able to enroll in coverage in the individual market, either on or off the exchange, to get that critical prenatal care. Lastly, in the coverage bucket, the bill improves coverage in our health insurance affordability enterprise. So this is a program that's for folks who've been left out of health insurance reform in our state, and it specifically improves coverage for things like emergency services. Second bucket are perinatal supports. First, the bill makes breast pumps a covered benefit in Medicaid and CHIP. So it means anyone in the perinatal period who wants one will be able to access a double electric breast pump if they use Medicaid or CHIP for their health insurance coverage. That's been a benefit in private plans, but not for Medicaid and CHIP. So just helping sort of level that playing field and make sure folks have access to the tools that they need to feed their babies in the way that they want. It also creates a stakeholder process to determine how best to draw down additional federal resources to support the perinatal period in Colorado. Lastly, around data, the bill codifies and strengthens Colorado's Healthy Moms survey out of our public health department. It funds that program going forward and says that African American and Indigenous folks need to be sufficiently sampled so that we can gain an understanding of their experiences in that critical perinatal period. Can't talk about this bill without really quickly talking about the incredible stakeholder process that got us here. This bill was led by 11 directly impacted folks from across the state. So these are folks who maybe didn't have coverage when they had their kid because of their immigration status, or maybe have one kid who has Medicaid and one kid who doesn't qualify because of that kid's immigration status. Those folks made all of the key policy decisions on this bill. They were convened by our partners at the Center for Health Progress and CIRC. We also worked with a number of other incredible policy organizations to get all of these pieces fit together right, including the Colorado Community Health Network, the Colorado Center on Law and Policy, Planned Parenthood, and COLOR. So great team, great bill, couldn't be more excited. And thank you for all of your support this session.
The success of so much of what we're trying to do relies on the vital next implementation steps. We want you and advocates involved every day to make sure that we can take action to live out this vision that I described, where families have a chance to thrive in their earliest years. Thank you so much for your commitment and advocacy to early learners, early childhood in Colorado, and to the caregivers who make our state and our communities thrive.